Thus far, the war on drugs is a failure. It has failed to prevent drug abuse, failed to keep drugs out of the hands of addicts, failed to keep drugs away from teenagers, failed to reduce the demand for drugs, failed to stop the violence associated with drug trafficking, and failed to help drug addicts get treatment that they need. In addition, the war on drugs has affected countless lives across the nation and world. Tax dollars are wasted attempting to prohibit drug use and transport, although whether it be our national borders or our local pharmacies, it is clear that the supply of drugs cannot be stopped.
I am a retail pharmacist for Walmart Pharmacy. My daily routine involves filling hundreds of prescriptions on a daily basis.
Prescription drug advertising directly to consumers persuades people to ask their doctors for specific brand name drugs. These drugs are often more expensive, unnecessary, and dangerous. They create problems for both patients, prescribers, and providers.
I see prescriptions that are advertised that people bring into my pharmacy, and it's frustration for them, it's frustration for me when I have to tell them that the drug that they went to the doctor for and asked the doctor to prescribe is not covered on their insurance plan. And if it is, it requires some additional paperwork from their doctor, or if it is covered, it's extremely expensive and the patient can't afford it anyway. So it becomes a great waste of time for prescribers, patients, and for myself, because most of the time, I would say 90% of the time, I end up calling the doctor to get it changed to something else that the patient's insurance covers.
More advertising leads to more prescriptions. Direct-to-consumer advertising contributes to the nation's dependence on drugs. Addiction, withdrawal, and severe side effects are serious risks of prescription drugs.
My pharmacy fills, on average, about 600 prescriptions a day. The particular pharmacy I am employed at has a very large Medicare population. That's people age 65 and older. They on average take 6 to 7 medications, and that would just be an average.
How frequently do you see signs of prescription drug dependence and addiction?
Drug dependence and addiction definitely affects my profession on a daily basis. I see lots of legitimate prescriptions for pain medicine, anti-anxiety medications, ADHD medications that are completely legitimate and used correctly. However, also I see on a daily basis these same prescriptions that are used and abused. I see fraudulent prescriptions brought to my pharmacy. I probably get on average 2 to 3 fake prescriptions brought to me a week, and it is incumbent on me and other pharmacists to try to figure out which of these are fake and which are legitimate. Sometimes that can be difficult. I've been fooled many times. Most of them we catch, but people are good at bringing fake oxycodone prescriptions to me and wanting them filled. Young people in their 20s, and they have no need of these medications, but they pay the doctor enough money that they write them, and the prescription's legitimate from a legitimate doctor, but the medical use is not legitimate, and these get out on the streets.
Prescription drugs and other illegal drugs have much more harmful effects than marijuana, and they are heavily advertised to the public. Yet law enforcement is much more prevalent for marijuana than other drugs. We interviewed Mizzou's NORML organization to get their input. NORML is a non-profit public interest advocacy group representing the interests of tens of millions of Americans who smoke marijuana responsibly.
Don't alcohol and tobacco use already cause enough damage to society? Why should we legalize another intoxicant?
While there are indeed health and societal problems due to the use of alcohol and nicotine, these negative consequences would be amplified if consumption of either substance were prohibited. Marijuana is already the third most popular recreational drug in America, despite harsh laws against its use. Millions of Americans smoke it responsibly. Our public policy should reflect this reality, not deny it. In addition, marijuana is far less dangerous than alcohol or tobacco. It fails to inflict the types of serious health consequences these two legal drugs cause. According to a recent World Health Organization report, alcohol consumption is linked to 4% of all deaths worldwide. Similarly, more than 400,000 deaths each year are attributed to smoking tobacco. By comparison, marijuana is non-toxic and cannot cause death by overdose. No one is suggesting we encourage more drug use, simply that we stop arresting responsible marijuana smokers. In recent years, we have significantly reduced the prevalence of drunk driving and tobacco smoking. We have not achieved this by prohibiting the use of alcohol and tobacco or by targeting and arresting adults who use alcohol and tobacco responsibly, but through honest educational campaigns.
Why should we decriminalize or legalize marijuana?
As former President Jimmy Carter acknowledged, penalties against drug use should not be more damaging to an individual than the use of the drug itself. Nowhere is this more clear than in the laws against the possession of marijuana in private for personal use. Marijuana prohibition needlessly destroys the lives and careers of literally hundreds of thousands of good, hard-working, productive citizens each year in this country. More than 693,000 Americans were arrested on marijuana charges last year, and more than 5 million Americans have been arrested for marijuana offenses in the past decade. Almost 90% of these arrests are for simple possession, not trafficking or sale. This is a misapplication of the criminal sanction that invites governments into areas of our private lives that are inappropriate and waste valuable law enforcement resources that should be focused on serious and violent crimes.
Along with there being a pressure from big advertising firms to purchase pharmaceuticals, along with how people addicted to them are treated compared to those using marijuana, there also seems to be a race discrepancy involved. Throughout history, there has been a race issue in the United States, and it has been perpetrated through the arrests made by cops in connection with marijuana use, which was talked about earlier by Osama. I posted a survey in the Mizzou Class of 2018 Facebook page, so there was a pretty wide option of people that could have taken my survey. I asked what the people's race were and how many of their friends used marijuana. A lot of the people that took my survey were Caucasian, but the answers to my questions did vary greatly. I asked if they thought marijuana use was equal in both races, and out of the 88 people that answered the question, 78% said they thought it was equally used between all minorities. I also asked if they thought that the police convicted these users fairly, and about 2/3 said no. They convicted mostly African Americans, even though almost all of these same people said that marijuana use was fair between races. These police should be focusing more on the reason they're arresting these people rather than making up an excuse or just profiling based on someone's race. So now I'm going to turn it over to Kyle, and he's going to talk about some other things that the government can do that focus on illegal drug trafficking, widening the spectrum for everyone.
Over $1 trillion has been spent on the drug war since it began in the early 70s. The drug war has unfortunately created more violence on our southern border, creating economic disparity and displacing thousands of families and businesses. The same money that was supposed to prevent instability and create a sober society is ironically escalating the violence and turmoil. So where exactly are these billions of dollars going, and why haven't they yielded any positive results? Well, most of the money goes to police hardware, like what you see right behind me. This is because politicians like seeing immediate results, and hardware shows that. Rehabilitation and prevention programs are costly and don't immediately yield results. We need to look at countries that have liberalized their drug policies, such as Portugal, which have halved their addiction rates, if we're seriously looking to reform our drug policies.
Look at Portugal, where nobody goes to jail for possessing drugs, and the government's made a serious commitment to treating addiction as a health issue. Look at Switzerland, Germany, Netherlands, Denmark, England, where people who have been addicted to heroin for many years and repeatedly tried to quit and failed can get pharmaceutical heroin and helping services in medical clinics. And the results are in. Illegal drug abuse and disease and overdoses and crime and arrests all go down, health and well-being improve, taxpayers benefit, and many drug users even put their addictions behind them. Our true challenge is to learn how to live with drugs so they cause the least possible harm and, in some cases, the greatest possible benefit.